Hi everybody, thank you for joining me. My name is Brandy and welcome to Dark and Twisted. My story is about spinal issues, and my story all started with having scoliosis. I also have been diagnosed with having spina bifida, spondylosis, spondylolisthesis, pars defect, kyphosis, degenerative disc disease, and of course depression. So I want to share with you guys my personal story because I want to help others like me, and also want to let you all know what I went through, and maybe it will help your situation. So we're going to start with scoliosis. If you're watching this and you have scoliosis, you are familiar with the fact that it's a curvature of the spine. You can either have an S curve or a C curve. I have an S curve. I was diagnosed at 9 years old with having a curve. It was actually dismissed as being normal. As I aged 10 and 11, my spine actually progressed, which is normal, and I was braced, which was two metal rods that went here. The plastic part formed to my body and also had the metal going down the back and covered my hips. I wore this brace 23 hours a day. I could only take it off for sports and to shower. So I had to function all day in it, and I had to sleep in it. Being a young person, obviously this is very scary, and I'm sure if you're a parent out there watching this video, you feel just so horrible watching your child go down this road. So I'm just going to share with you guys a little bit what I remember going through at that stage in my life. So we started off with the brace, but I had also seen a chiropractor. Chiropractors are more reluctant not to work on people that have been fused, but if this is pre-fusion, you might see or get pain relief by going to a chiropractor. In the time frame of seeing the chiropractor, I actually had grown 2 inches and my curve had decreased. But at the age of 12, going through puberty, actually that's when my spine just went crazy, which is very normal. Alright guys, so I actually would like to talk a little bit about the brace. I was in 6th grade wearing the brace, and if you are a parent going through this with your child, it is quite devastating to watch your child go through this. It is very uncomfortable and very hard to deal with. I do see a lot of people concerned that the brace may not solve their problems. Unfortunately though, with scoliosis, you really don't know what could happen. Wearing the brace, I definitely remember having to wear an undershirt underneath. I would wear the brace, and then I would try to find clothing to wear on top of it. Something loose. It wasn't too restricting on my body. Also, one thing that is a concern is being a kid, wearing this to school, having kids look at you, ask questions, make fun of you, laugh at you. Those are all real things that do happen, and you definitely have to encourage your child that things are going to be okay. It's okay to be different, and you have to be their support system. I remember having my parents go up to the middle school and talk to the principal, talk to the counselors, talk to my teachers, just to, let people know, why am I wearing this crazy brace and what is it for? I definitely do remember having kids make fun of me. Like I said, life is not always going to be rainbows and unicorns. It's going to get dark. It's going to get hard. It's going to get stressful. You are going to cry. You're going to ask yourself, why is this happening? That's just part of life. So I remember being wintertime, Christmas, my mom telling me that she was having a hard time finding clothes that I could wear, something that would fit over the brace. you're going to go through that, but just know that it's all going to work out, and you're probably taking in more stress than the child actually is. So I wore the brace. I hit 12 years old. I started puberty. Unfortunately, my curves increased tremendously. I remember it was April. I seen my back doctor. I only had one choice, and that was to have a fusion. So I actually had my first fusion November 11th of 1993. I was in the hospital for 2 weeks. I spent a few days in ICU. I definitely appreciated people coming to visit. I remember how awesome the nurses were. Back then we had Nintendo, so they would roll in the cart with TV for me to play my Nintendo. I definitely appreciated the stuffed animals, the flowers. You know, it's a really hard thing to go through being a kid, and of course being the parent. I believe the surgery was around 8 hours long. Now, the surgery they performed on me, I have an S curve. We actually only fused the top curve. Why did we not address the bottom curve? Well, it wasn't that bad. And truthfully, you never know how your body's going to react. Now, usually when they do a full fusion, they also go through the front of you. Now, being 12 years old, female, you are risking a lot of your reproductive organs and also your mobility. And being athletic, my parents wanted me to continue having the best life that I could have, so we didn't do the full fusion. So only the top curve was fused, and 2 weeks in the hospital, I was told not to play football, no gymnastics, no skiing, and no diving. So I actually took 4 months off, and I went right back into starting to train for track in 7th grade. I took that summer off of soccer, and that following fall I was back playing basketball. Now, I did have a back brace similar to one I am wearing right now. I tried wearing it during basketball, but I didn't like how I couldn't bend over as well, and I kind of felt restricted, so I wasn't a big fan of wearing the brace. Also, doctors are going to tell you not to wear that brace all the time because they want your muscles, especially your back muscles, to not become weak wearing the brace. So I also had a shoe lift when my left leg is shorter than my right. So I remember having a shoe lift that I would wear in my shoes, and my parents always made sure I was wearing good cushioned arch support shoes. It's definitely very, very crucial. But I also want to let you all know to keep doing whatever you're doing, especially when you're a kid. If there's a sport that you love to play, keep playing it. You know, if there's something that you enjoy doing that's not going to cause you pain, I definitely encourage you all to keep doing what you're doing. Because even though you're battling the pain, if you're doing something you love, it kind of balances out. I would like to focus on talking about chronic pain and depression. I have spent my whole life in pain. I have also spent a majority of my life crying, depressed, asking myself why me, what am I gonna do? And it's been really rough. I obviously have good days, I have bad days, doesn't everybody? But when you're in chronic pain and that's all that you know, it is really hard to deal with. Now, I have seen therapists, I have been on antidepressants, I've been down all of the roads possible. Definitely talking to a therapist is always good. Also, being open to your family and friends, just having somebody listen to you is very helpful. Medication-wise, you know, everybody's different. If you feel that you need an antidepressant, by all means give it a try. Since this last fusion, I have been put on amitriptyline, which also helps me sleep, but it also helps with depression. and restless leg syndrome, and I've been on that for almost a year now, and I do believe it is helping me, absolutely. Now, being in chronic pain, it is tough. I definitely feel I have pushed a lot of people away because I am in pain every day and I can't function like normal people do. You know, I get tired. My legs hurt, my back hurts, my feet hurt. You know, I can't go do certain activities like I used to. It's really hard. But I had to flip things around to say, God gave me this for a reason because he felt like I could handle it. And me making these videos for you guys is helping me as well. So I'm just throwing it out there. It's okay to cry. It's okay to be mad. But you can't stop believing in yourself. You know, you got to keep pushing through the pain and try to lead a successful, happy lifestyle. You know, I'm in the middle of a big change just because of this last fusion. I'm not functioning like I used to. I haven't worked. I'm having to move because I'm not getting the assistance I need, and it's been a drastic change for me. But I want to let you all know, you know, there's many of us out there. I've joined many groups on Facebook, spinal groups, so there are other people like me out there. So if I am bitching about something hurting, these people understand where I'm coming from. So keep your head up, guys, and just know that you're gonna get through this and you're worth it. We are focusing on recovery from having a L5-S1 fusion. So recovery from the fusion was rougher than I expected. It's given a 1-year recovery time. Also, what is very crucial is having bone growth. Now, because of my diagnosis, my doctor was definitely very afraid that I would never have bone growth. If you do not have bone growth, they classify that as a failed back surgery. They actually would have to go back in and kind of secure the rods and whatnot in place. I was obviously very fearful of that, given this was my 3rd fusion. There are different things you guys can do to help with bone growth, and one of those things is taking CBD. I'm definitely going to preach to you guys a lot about CBD because I think it's a huge game changer for people like us, especially needing bone growth. CBD actually promotes bone growth. So I took it every day, 3-4 times a day. It doesn't get you high, it doesn't get you sick. But it's crucial to promoting bone growth. I also was given a bone growth stimulator that I had to wear 2 hours a day, and that doesn't hurt. It actually just shoots electric vibes into your body to promote bone growth. So surgery was June 30th. I remember it was end of November, and doing something so little just to grab something, I could feel the difference. I knew there was bone growth, and what a difference that made in everything. I had started going to physical therapy when I was 3 months post-op. It was really difficult. 1 hour therapy treatment would lay me up for 2-3 days afterwards. You know, and being very active, athletic, exercising, working my whole life, to have a 1 hour physical therapy treatment knock me out for 2-3 days, it was really, really, really hard for me mentally to deal with that, because you just don't know if you're ever going to get better. But once you do have bone growth, to me that was really the game changer to let me know I can proceed with physical therapy, because I'm not nervous that I'm going to break a rod or shift a screw or do anything like that. So here I am 10 months later. I'm still on weight restriction. I can't lift anything over 15 pounds. Cane, back brace. I am still dealing with hip issues, and that's because I do have bursitis in my right hip. I'm trying to delay having a hip replacement because Lord knows I do not want to go down the road of having another surgery right now. I'm still trying to get over this one.
All right, everybody, I'm going to talk a little bit more about playing sports and staying active when you have been diagnosed with scoliosis. I continue to be active. We didn't really know which direction my life was going to go, but we opted to do just the T1 through T10 fusion to allow me to be able to bend and stay more mobile. So within 4 months of having surgery, of course, going through physical therapy, I was able to start running track again. I did take the summer off, spring and summer off of playing soccer due to direct contact. And then that following fall, I was back to playing basketball. I'm pretty lucky. I grew up with an athletic family. My father coached me in basketball and in track. So he obviously was very much well aware of what I was going through physically. So my best advice to all of you is to stay active. Yoga, walking, bike riding, Pilates are all so important. I can't stress that enough. The one thing that my spine docs always suggested to me was to keep my core strengthened because of my spine being so curved. I didn't have that support. Everybody is different. We all are more comfortable with different things than others. I just firmly believe in that if you have a child that is active, I think you should keep them being active. Because of my family and myself pushing to remain that way, I was able to do things as an adult. Granted, my spine was a mess. So after I had played sports and moved on to high school, I just concentrated on playing soccer and basketball. I played AAU basketball, and then I later went on to play at a junior college here in the state of Michigan. It wasn't easy. It was hard because I am only 5'5" at the time. If my spine was straight, I should be around 5'9". So that's kind of hard for me to deal with. The first year of playing in college, of course, was really hard. I mean, the girls are a lot bigger than me, and I was around a solid 120 pounds. After that 1 year, my back actually was starting to get worse. I was already aware that I had a diagnosis of being told that the lower part of my spine never completely fused together. They always refer to it as it being a hole in my spinal cord. Well, that has a name, and it's actually spina bifida occulta. Occulta means it's hidden. So I was being validated by doctors that there is legitimate pain down there, but nobody was really telling me what was really wrong. And of course, this is before internet and Google and everything like that. But my doctors always asked me how I am able to run. How are you able to stay active? And I just said, I don't know. I just do it because I love doing it. But it caught up to me. And, you know, I'm only now at the age of 19, 20, 21, 22, 23. Things got worse. The rods that were actually once straight were now grinding, visible, and also the spine twisted, kyphosis. So if I sat down on a chair, It was a hard chair. I would bump the rods, which would bruise me and cause me a lot of pain. Also, the rods, living in the state of Michigan, it gets really cold. I could feel the rain. I could feel the snow. Literally, my rods would freeze depending on the temperature outside. That is all very real. So I ended up opting to get the rods taken out. In 1993, surgeries were performed a little bit different. They would take bone from my hip to fuse to my spine. So it was fused with the rods, which are made out of titanium, and they were fused by my bone. So if you look at the x-ray of the rods being taken out, you notice all those upper vertebrae are blurry. Well, that's the bone. So that spine is not going anywhere. It is what it is. The surgery itself was a faster recovery, easier recovery, but still really serious. The fact that I became more numb in different places in my back, I still don't have those feelings back. I have a lot of nerve damage that was caused from first surgery and second surgery, which I just want to say that this all led down the road to other issues as well. So thank you for listening, and please join me again for more spine talk. Thank you. Thank you all for watching my dark and twisted tales. If you like what you are hearing and you would like to know more, please subscribe to my channel. You can also follow me on Facebook and on Instagram. Toodles!